Hello, this is Lauren Satterwhite with the NC Medicaid EHR Incentive Program. This webinar will cover some of the basics of patient volume, aka PV, narrowing in on some of the most common PV errors we run into so you can avoid making those mistakes. To be eligible to participate in this program, providers need to see at least 30% Medicaid patients. However, pediatricians may qualify by meeting a reduced Medicaid PV threshold of 20%. You'll calculate your patient volume by taking all Medicaid enrolled encounters in a consecutive 90-day period, including all zero-pay Medicaid encounters, and dividing that number by all the encounters you had from the same 90-day period. And remember, the resulting percentage needs to be at least 30% unless you're a pediatrician. An encounter is one patient per provider per day. You could have multiple claims for one encounter. For example, you might see a patient for a checkup and have a claim for a physical, a claim for a lab work, and one for a flu shot. That's 3 claims, but it's only one encounter. So be sure you're reporting encounters and not claims. If you need help figuring out how many PV encounters you've had in a 90-day period, there are a few ways to figure it out. You'll want to check your billing system, your scheduling system, your EHR, or anywhere that tells you about the patients you saw and who you billed in the 90-day PV reporting period. When you're calculating your PV numerator, another resource is the remittance advice, or RA, that covers the dates of service in your PV reporting period. RAs are available for free through the Message Center inbox on the secure NC Tracks provider portal. When reporting Medicaid zero-pay encounters, be sure you break those out and report them separately from Medicaid paid encounters in NC MIPS. We verify the Medicaid paid portion of your numerator during prepayment validations. The zero-pay portion is verified only during post-payment audit. And health choice encounters cannot be included in your numerator unless you practice predominantly at an FQHC or RHC and are including them as needy individual encounters. Something else to keep in mind when calculating your PV. Be sure your numbers are coming from an auditable data source. You need to be able to prove where your numbers are coming from. We advise that you create an Excel spreadsheet report of the information used to calculate PV and save that for 6 years in case of audit. The spreadsheet should include the patient's Medicaid ID number, the dates of service, and the rendering provider's NPI. When attesting in NC MIPS, use the EPMU attestation guides. It helps explain what we're looking for in each field. The PV section begins on page 34 in the guides. Again, the guides not only cover each field in detail, but it gives PV tips to help you attest. When reporting the billing NPI used during the 90-day PV reporting period, be aware that this might be different than the one you currently use. Be sure that you're entering the billing NPI where NC MIPS asks for billing NPI. Don't use your personal NPI that was used as rendering on claims as your billing NPI in NC MIPS unless you actually use the same NPI for both rendering and billing. You can verify your billing NPI by looking in the upper right corner of your RA if you have any questions. And triple check the NPI you're entering to be sure that you're typing in the proper billing NPI so you don't run into any issues. Incident 2 billing is when one provider actually has the encounter with a patient, but a different provider is listed as rendering on the claim. Using Incident 2 billing has been a common billing practice for groups that include a nurse practitioner, residents, new providers, etc. So it's very important to accurately report patient volume where Incident 2 billing was used. If any of your encounters were billed to Medicaid using another provider's NPI as rendering on your claims, you need to report this in NC MIPS. If another provider's NPI is listed as rendering on your encounters, you must report that other provider's NPI and the number of Medicaid paid encounters that belong to that other provider. If you fail to include this information, we can't validate your attestation. See page 39 of the attestation guides for more instructions on how to report Incident 2 encounters. In addition to the guide, we have Incident 2 webinars and PDFs that explain the ins and outs of reporting PV where Incident 2 billing was used. And these can be found on the PV tab of our website or under the Resources and Webinars tab of our website. If you billed encounters to Medicaid indirectly through an LME, you need to complete the behavioral health template to report these encounters. The template is on our website in the patient volume section. Please read the instructions on the template because they will help you fill out the information properly. There are a lot of PV resources out there to help you. The PV tab on our website has more detailed PV webinars, PDFs, and general PV information. The attestation guides on NC-MIPS actually help you during the attestation. And we have a PV section on our FAQ page that addresses common PV questions. You can also contact the NCA HECS. They have boots on the ground and can provide more personalized attestation assistance. See the Technical Assistance tab of our website for contact information. And remember to attest as soon as possible. No changes can be made after the program year closes, so give yourself time to address attestation discrepancies by attesting sooner than later. And remember, we can't guarantee that we're going to review your attestation unless it's submitted at least by March 31st of 2018. If you submit in April of 2018, there's no guarantee that we'll be able to review your attestation and provide feedback, so be sure to attest early. Thanks for tuning in, and please let us know if you have any questions. Our email address is ncmedicaid.hit@dhhs.nc.gov.